Hi Grand Fondo riders, my name is Andrew Stewart, physical therapist at Mammoth Hospital. Just wanted to go over a few tips and tricks to make sure your bike fits you before the upcoming season. One of the biggest problems I see as a physical therapist is knee or hip pain. Oftentimes this correlates to saddle height position. So a quick test to make sure that your saddle is at the right height for you is to come down, unclip or take your shoe out, and then put your heel right on the pedal, right in line with the seat tube. And if your knee is straight in this position, that's a good saddle height. If it's too bent, I'd say raise it up a little bit. Or if you're not quite able to touch with your knee straight, I'd say lower it a little bit. Another source of knee pain is where your knee is relative to your foot on your pedal. A quick test to see if your foot's knee is in the right position is to stop at about 3 o'clock right here and take a look at where your knee is relative to your foot and the pedal spindle. We want knee right about over the pedal spindle. If it's too far back, scoot your saddle forward. If it's too far forward over your knee, scoot your saddle a little bit back. Another common complaint I see among cyclists is shoulder and neck pain. Oftentimes this stems from the thoracic spine, or the section of back where your ribs are. This can be fixed by kind of lifting your shoulder blades, shining your chest forward down the road, and actively pushing into the bars here. Try these tips and tricks out, and if you're still having trouble, we're offering bike fits at Mammoth Hospital. Check out elevatemammoth.com for more information and to sign up.